Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today I want to introduce our guest as we speak about physical therapy for the neck and back. Sean Berman has been an orthopedic and sports physical therapist for 19 years. He is an orthopedic clinical specialist and a certified McKinsey practitioner. Sean has worked with Oak Bend since December 2011 and has been at our Williams Way outpatient PT clinic since March of 2020. Welcome, Sean. We're glad to have you today.
Thank you for having me.
So, can you tell us what is the prevalence of neck and back injuries in the U.S.?
So neck and back injuries constitute a big problem in the United States and worldwide, but depending on the study you look at, anywhere from 60 to 80% of adults will have some form of neck or back problems in their lifetime. So it's a very expensive injury in the healthcare field.
Right. And I know over the years, it's kind of changed. In the past, people would go to their family practice and maybe get some pain pills and muscle relaxers and relax. But now they're talking about physical therapy is a great way to relieve the pain and get back on. So with current medical literature, it suggests moderate to strong evidence supporting the benefits of physical therapy's role in reducing neck and back pain and improving range of motion. Can you kind of elaborate on that?
Yeah, so for some folks, medication and even sometimes just rest will kind of take care of it. A high percentage of folks with neck and back pain, it's self-limiting, anywhere from 3 days to a week. But for those people that don't get relief from that, then that's kind of where we come in. We can assess, look at range of motion deficits and determine what kind of activities kind of help regain that without causing further injury. The old adage, no pain, no gain, does not necessarily hold true. So if, a lot of times folks are trying to push through the pain, and in reality, they're just exacerbating the problems. So we're trained in assessing musculoskeletal injuries, and so we can identify some of the mechanical deficits that maybe the medication didn't address. And so there's different things where we can do some manual therapy or teach different stretches and exercises to help stretch and strengthen. So there's a lot of good research to support that PT can help. And it's also considered conservative. So, some folks are very hesitant about getting into the, healthcare system because they're afraid of surgery or, shots and things like that. But we're on the conservative end. And so that's a good starting point. And then as the laws have changed and things like that, in some states, and Texas is one of them, you can get a physical therapy evaluation without a referral from your doctor. So we can be a point of contact. And we're also trained to recognize like, hey, this is something I'm not qualified to help. So then we can also help direct them to appropriate care when needed.
So what are the most common causes of neck and back pain in a patient you see in the clinic?
There's so many different causes, but I'd say probably one of the, if not the primary cause, but being factors would be sustained poor posture, things like that, repetitive motion, work-related injuries, whether it's, somebody that does a physically demanding job, car accidents. But I would say probably the most common thing that I see is related to prolonged sitting or sustained poor posture.
So you're able to help with that. So if someone, let's say, has even had back surgery, and they tend to get stiff and their back's hurting all the time, are those things that you're able to help with?
Yes, we can. It's pretty common to have PT after neck or back surgery, but yeah, so we kind of do a full, kind of postural assessment, things like that. But really, it's also understanding general spine health and limiting poor postures, modifying your workstations, potentially, depending on your employer, working with a lot of employers have ergonomic specialists that will come in and do, workstation assessments and give you suggestions on correcting that. But after surgery, a lot of times, one of the things that I say we'd probably spend most time working on is not necessarily regaining range of motion, although we do that, but kind of building up some of the strengths and addressing some of the deficits that were as a result of the injury that necessitated the surgery, or some of the weaknesses and lost motion that made them to where they needed to have surgery. So our goal is to kind of get them back to where they were and kind of strengthen and stabilize and hopefully prevent further procedure.
And sometimes a few years after the surgery, you may have scar tissue building up, or you've been more sedentary. Is there something you can do for that?
There is. It depends on, the term scar tissue kind of gets a bad rap. Scar tissue is actually healthy tissue, but sometimes it gets that you get too much of it, or as our body scars and heals, it heals in a shortened position. So one of the things we look at is trying to kind of lengthen that scar tissue, improve the mobility, because if you don't have the mobility, then you also can't have the strength. There's a direct relationship between length of tissue and our ability to, be strong and generate power and force, which that all adds up to stabilizing our body.
Well, and I think that's kind of where I was going with it. I think people, after they have back surgery and it's been a while, it's tolerable pain, but it's still immobilizing pain at times. And I think they think it's the best they can get.
That's true. After surgery, a lot of times, especially if you, took you a little while to recover. And as we get older, it's harder to recover. So then there's oftentimes folks, they think that they've maximized their potential. And the reality is that they might have a lot more potential than they thought. And so we definitely can help with that, and, determining what is a realistic goal for them and coming up with a way to help them reach that goal and improve their overall, quality of life.
Wonderful. So what is the difference between passive and active therapy?
So passive therapy is a type of therapy where it's done for you or to you. So that could entail, kind of traditional modalities like hot packs, electrical stimulation or TENS, or even manual therapy, where we might do some form of massage or soft tissue mobilization, manual stretching, or joint mobilization, where we try to improve the mobility at the joint level. And then active therapy is where you're doing the work. So we teach how you can stretch yourself or build up strength. But also one of the things that I really focus on is that we have to move around in our environment. And so we work on creating strengthening activities or movements that, you're moving your own body, because that's what you have to do in your daily life. So that would be kind of the big difference between active and passive.
Okay, that makes sense. And then you're a certified McKinsey practitioner. Can you tell us what treatment approach that is, or what it is?
So there's a lot of misconceptions out there, even within my field, where they think it's a group of exercises, but really the McKinsey approach is an evaluative approach. So there's a set evaluation of somebody with neck or back or mid-back pain. And so we go through the whole assessment, and then we work on classifying them into different treatment groups. And so then based on that classification, we will specifically prescribe certain exercises. Now, these exercises anybody uses. They're very common exercises, but we just use them in a very directed manner. So there's sometimes people refer to, I did those McKinseys, and it's an exercise to stretch your low back. But the reality is that exercise has been around long before Robin McKinsey created his treatment approach. And so it really and truly, it's an evaluative approach to allow us to classify a person's symptoms and then therefore generate a specific treatment approach. It also focuses on more patient-centered approach, so that we try not to create dependency on us to where we do everything for them. So it tends to be a little bit more of an active therapy approach. That doesn't mean I don't do stretches or manual mobilizations on my patients. It just means that I try to teach them strategies that they can do the same type of corrective movements and provide pain relief for themselves.
Okay. So I've always heard you want a strong core in order to keep a healthy back.
Yes. So I kind of laugh when we talk about the core, because it kind of gets misrepresented. A lot of people associate the core with just your abdominal muscles, but the reality is your core encompasses a huge portion of your body. So I kind of generalize from kind of your sternum or just under your breastbone all the way down to your knees, all the way around your body. So it incorporates to a certain extent, even some of the muscles that move your arms and your shoulder blades, to your buttocks, to your thighs, all the way down to your knees. And so all that has to work together to create a firm foundation from which we move upon. So our core is really just our foundation. Think of a crane that's picking something up that's really, really heavy. If the base of the crane is not stabilized, then when it goes to lift that heavy thing, the crane is going to fall and collapse. So that's what our core does, is it creates that strong base that we can move our arms, our legs, and just kind of move around in space.
So, Sean, I think a lot of us lost our core over the last year and a half.
I think so. Actually, I think one of the unintended consequences of kind of the quarantine, I have personally noticed a big influx in patients that have had a big increase in symptoms. I've heard many, many times in the last year. I've had problems with my neck or my low back for the last couple of years, but it was manageable. But 6 months ago, and then as we kind of get into the details, a lot of people started having an increase in symptoms when they were working from home, after a couple months of being quarantined. So absolutely, I would agree that a lot of us have lost our core.
So people are getting back out there, and they've been sitting a year and a half, and they want to start exercising and gardening and all this stuff. Do I sound like I'm speaking from experience?
Maybe.
And the first thing that hurts is your back and your neck.
Yes.
So is there something you can do for those sedentary people that have been out there that are wanting to get back into it? Is there therapy that can help with that?
Well, there definitely is therapy, but even before I would recommend that a therapist would just be one, changing kind of how you approach. A lot of people have sedentary jobs, and when they're working from home, you become even more sedentary. So the number one thing, just general spine health as a whole, is you don't want to sit for much more than 20 or 30 minutes without getting up and moving around. So just doing something as simple as setting a timer on your phone every 30 minutes to get up. And it doesn't mean you need to go for a long walk, but I tell folks, literally stand up, walk around your desk, sit back down, for two reasons. One, some of the structures in our spine don't have a blood supply. So the way we get nourishment to those structures is through movement. So if you're not moving, you're not getting that nutrient exchange. So if you do have a low level injury, it's harder to heal if you're not getting that movement in there. And then secondly, when we first sit down, we have our best posture. So if you're getting up every 20, 30 minutes, moving around even a small amount, when you sit back down, you're in a much better postural alignment. And then as time goes on, you're not in that poor posture for as long. So the cumulative effect is very beneficial. So that would be my first piece of advice, is just start limiting how long we're sitting. And then just something as simple as walking. Folks don't realize, even just for our neck, just walking and is so beneficial from just about every system in the body, but very much so for the back. And even for one of the other problems with being sedentary is, arthritis in the knees and hips, that'll stiffen up. So just the walking alone will help loosen everything up, and start gradually. It's like any good habit, you can't jump right in because it becomes unsustainable. But if you start slowly and gradually increase your activity level, that's a good start. And then if you're going to get in that garden and start working, don't try to do it all at once. You can do it over a couple of days.
It can be painful.
I know.
So when should we see a physical therapist for pain?
So I maybe not necessarily just physical therapists, but in general, if you have an acute onset of pain and it doesn't go away within 3 to 5 days, then that's when I would start, seeking treatment. Because like I said, so many of the injuries are self-limiting. If, sometimes you can, you wake up with a crick in your neck. A lot of times that resolves on its own after 3 or 4 days. But if it starts getting worse, then absolutely you want to seek care, whether it's with a PT or your primary care doctor. But also if you start to notice symptoms moving. So if you start off with a crick in your neck, and then 2 or 3 days later, your neck feels better, but now you've got some numbness and tingling in your fingers, that's definitely a sign that although the neck feels better, the symptoms have actually worsened because now it's pushed into your arm. So anytime symptoms kind of move away from the spine into the arms or into the buttocks or legs, that would definitely be a time to seek treatment. But that's what, one of the things that we're really good at doing as PTs is kind of determining like, okay, this is something that's very manageable. You just need to give it a little time, or no, you actually need to go get some diagnostic studies. And so you need to go see your doctor.
Right. And if you do go see your doctor, you can always ask your doctor, do you think physical therapy might help? Because
Absolutely.
a lot of times that's a good answer to it.
Absolutely. Especially if you've spoken to a therapist and they say, hey, I think you need to get some diagnostic tests done. If everything checks out, then absolutely it would be a good idea to ask for some therapy to help kind of facilitate getting the thing knocked out as quickly as possible.
So I know a lot of people say, oh, my neck hurts, my back hurts, I'm going to go get a massage. But it continues to hurt. At what point do you let the massage go and seek more clinical treatment?
So I'm gonna kind of back up a little bit. So, massage can be great, and we do a lot of times we incorporate soft tissue mobilization, massage, and stuff in the therapy. The problem is that, and I've always just kind of classified it as there's primary pain and there's secondary pain. So a lot of times the primary pain is coming from the spine, but it can push pain into the muscles. So then the muscles are hurting in and of themselves. And so I call that secondary pain. That's where massage can help. But what folks have to look at is, okay, I go to the massage, my muscles feel better, but how's my baseline pain? Does it go right back to where it was before, or is it actually getting better and better? If it's just a temporary relief that lasts, a couple hours or even a day, then the massage is just kind of helping you manage the symptoms. It's not treating the underlying problem. So that's when I would go and, seek some further treatment or talk to a therapist or, their doctor. Because if the muscles feel great, but the underlying spine is still problematic, then you're not going to get very far.
Okay. And then we have some OB women that suffer with back pain and sciatic nerves and those kind of things. Is physical therapy beneficial to that?
Are you talking about postpartum or while they're pregnant?
While they're pregnant.
So absolutely. And actually at our Jackson Street location, we have a physical therapist who specializes in women's health. That would be somebody that would be a great resource to contact if you happen to be pregnant and you're having those type of symptoms. But yes, there's definitely different strategies that can help with that while they're pregnant. And then depending on the type of symptoms they're having after pregnancy, it could warrant, if they're having a lot of pelvic pain that also causes back pain, then that's where a women's health therapist would come in and help out a lot. And then if after the birth of their child, if they're just having kind of general back pain or SI pain, that's where I treat a lot of that. But if it's kind of more related to the pregnancy itself, that's where a women's health practitioner is much more adept at helping those types of folks.
So, Sean, I think you covered it, but in wrapping up, I kind of want you to repeat it. What are the keys to good spinal and neck health?
The most important part is having good posture. Our head weighs about, with our brains, about 15 pounds, even if we feel like we're full of hot air. So if you're leaning forward, kind of poking your head forward like a turtle, that is very difficult on the back part of our neck and our muscles. So I tell folks, imagine holding a bowling ball, a 15-pound bowling ball out in front of you. That's going to be really difficult. But if you cock your wrist back and set that ball on your palm, and your arms vertical, you can hold that a lot longer. It's the same thing with posture. If we're poking our head forward, we're just putting so much low-level stress on our spine and our muscles that in an 8-hour day, it just has a cumulative effect. And if you're doing that day in and day out, the same thing with the low back. It's just kind of like a rope fraying. It's a low level of stress, but the longer you have it there, at some point, our spinal structures have a breaking point. So just sitting with good posture, using a lumbar roll or support for the back to kind of give you passive support is really important. Limiting how long we're sitting, we kind of talked about that, but then just movement in general is so great for the spine. So those would be the main things I would do. If people have an exercise routine, but they don't really want to do core stabilization, that's fine, because whether you realize it or not, you're strengthening your core at the same time.
If you're living with back pain every day, or waking up with back pain and going to bed with back pain, or neck problems and everything else, I would encourage you to go to your physician or go straight and get a consult with physical therapy, and seek some kind of treatment, because you don't have to live in pain. Would you agree, Sean?
Absolutely. And sometimes folks, they're at a point where even just a little bit will help. So it's absolutely important to, seek treatment, because you don't have to resign yourself to a lifetime of extreme pain. There's ways to manage it and, improve it and find new ways to do things that you want to do with less pain.
Great. I want to thank you, Sean, for joining us today. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. If you have any questions or you want to make an appointment, we will be posting Sean's access number and everything so that you can get in hold with him. Take care of yourselves and make sure that you live a pain-free life. Thank you, and we'll see you next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.